Hi, I'm Ellie, and today I'm going to be talking about hemophilia A. So, hemophilia A is a bleeding disorder and it alters the blood's normal coagulation process, meaning that it basically slows down blood clotting. And people affected by hemophilia A experience prolonged, excessive, and continuous bleeding after an injury or surgery or spontaneously in some cases. This disorder can be mild, moderate, or severe. So, in milder forms, it might not become apparent that someone has hemophilia A until they have abnormal bleeding after a surgery, like getting a tooth pulled, or after sustaining an injury. But in severe cases, excessive continuous bleeding occurs even after minor injuries like a paper cut, and spontaneous bleeding often can occur when there's no obvious injury, and this includes internal bleeding. So, hemophilia A can cause life-threatening complications as a result of bleeding into joints, the brain, or other organs. So hemophilia A is caused by a mutation in the F8 gene on the long arm of the X chromosome in position 28, which is what that XQ28 refers to. Um, the image on the right shows the X chromosome and the F8 gene's location on that chromosome. And the mRNA CD sequence for the F8 gene is 7,056 base pairs in length, which means that it is larger than the average gene, which has around 3,000 letters. And then the F8 gene encodes coagulation factor 8, which means it basically holds the instructions needed to make the coagulation factor 8, which is a protein. So, the coagulation factor 8, as I was saying before, is a protein in the blood that is essential for the formation of blood clots. In its inactive form, this protein is bound to the von Willebrand factor, which is another protein, and it circulates in the bloodstream in this form. And then when a blood vessel is damaged, coagulation factor 8 becomes activated. It separates from the von Willebrand factor and then interacts with another protein called factor 9. And then this interaction sets off a chain of other events, which eventually results in the formation of a blood clot, which is why this gene is so important. So there are many different mutations in this gene that have been identified to cause hemophilia A. Some are point mutations, meaning they only change a single base pair, and others insert or delete multiple. However, inversion is the most common mutation of the F8 gene that leads to hemophilia A. So an inversion mutation is when a segment of the genetic code becomes reversed in orientation relative to the rest of the chromosome. So the inverted segment runs the opposite direction. And an inversion of intron 22, which is a specific segment of the uh, genetic code that makes up the F8 gene, is the most prevalent genetic abnormality that causes severe hemophilia A in about 45% of patients. So variants in the F8 gene can reduce the production of the protein coagulation factor 8, or it can cause abnormal proteins to be produced. This results in the body being unable to form blood clots in response to injury. And then variants of the F8 gene involved in severe hemophilia nearly completely inhibit the activity of these proteins. And then variants that cause mild and moderate hemophilia reduce the activity but don't eliminate it completely. So, hemophilia A is inherited in an X-linked recessive pattern. This means humans have two copies of each gene, so a recessive disorder means that an individual has to carry two mutated copies of the gene to be affected by the disorder. Since males only have one X chromosome, only one mutated copy of the F8 gene in each cell can cause this condition. And this is why hemophilia A actually occurs predominantly in men. So females who have two X chromosomes, usually one variant has to occur, or a variant of this gene has to occur in both copies of the gene to cause a disorder. But in some cases, X inactivation can occur in females, which means that one of the female's X chromosomes is turned off in their non-reproductive cells, meaning that only one copy of the X chromosome is activated in the cells. So only one variant is needed to cause the disease in females who have this X inactivation. And then this is an image of a pedigree I made for the family affected by hemophilia A. It follows 4 generations, as you can see. The boxes are males, the circles are females, and then the shaded black ones means that someone is affected by hemophilia A, and then the circles with the black dots, means that there's a carrier of hemophilia A. So this means that female has one variant of the X chromosome, but is not affected by the disorder because she only has one. So you can also see that this disorder primarily affects men in this pedigree, and it skips some generations as it is a recessive inheritance mode. And then there are a variety of different genetic testing options available to check for specific diagnosis in affected individuals, and then also to check for carrier status in females. So these different methods include inversion analysis, sequence analysis, and deletion duplication analysis. These tests can be done for the individual themselves, and then oftentimes can also be done prenatally as well. And then genetic testing is not required to diagnose hemophilia A, but it is the only way to tell if a female is a carrier of the disorder. And prenatal genetic testing or testing soon after birth is strongly recommended for babies born to families with a history of hemophilia A, or babies whose mothers are carriers, and then also babies who have abnormal bleeding symptoms after birth. So the F8 inversion analysis is recommended for males affected with severe hemophilia A, and for at-risk females, which means that there's someone in their family that has hemophilia A. And for the females, it's in order to identify carrier status. This test detects common F8 gene inversion variants using PCR analysis, which is polymerase chain reaction analysis for intron 22 and intron 1. This just means that the test looks for inversion mutations specifically in the intron 1 and 22 sections of the genetic code, which are the most common places for these mutations to occur, as I was saying earlier. And then this test can also be done prenatally. Next, the F8 sequence analysis detects a single nucleotide and copy number variants in the F8 gene through the use of next generation sequencing. This means that the test scans the whole F8 gene for the presence of variants or mutations, and this test is useful for confirming clinical diagnosis in males, and then also assessing hemophilia A carrier status for at-risk female patients again, as it was with the other test. And this test can also be done prenatally when an F8 variant has been identified in a family member. And then lastly, the F8 deletion duplication analysis uses multiplex ligation-dependent probe amplification to identify large deletions and duplications in the F8 gene. And they do this by comparing copy numbers of a set of DNA sequences in a patient sample to a control sample. So this means that it's a test used to detect hemophilia A that is caused by mutations that specifically insert or delete nucleotides into the genetic code. And this test is not done as often as the other tests, as it only identifies mutations that account for a much smaller proportion of individuals affected by hemophilia A. Whereas like for the inversion analysis, that specific mutation is causes a lot more cases of hemophilia A, so it is done more commonly. And then these are my references. And that's it. Thank you for watching.